I have a message from Larry Petrie, and let me read this to you. I have a blood pressure and have recently become very focused on lowering my sodium intake. My recent blood pressure at the doctor's office was 140/90. It's much lower when I take it at home, 110/70. I wonder if it's a white coat syndrome sometimes. People go in and, by the way, the blood pressure has to be at least 3 measurements.
Correct.
That's another thing that we need people to know.
You want people to sit and relax for about 5 minutes in a seated position, and they should check it on their right arm because the pressure in the right arm is the closest pressure to the heart. And after they check it one time, they should sit and relax for a few more minutes, check it a second time, and then do a third. And you want to do that over time. A single measurement isn't relevant. In other words, you could come to the office, be late, you could come to the office, the doctor's running late, anything could happen that would raise your blood pressure. We call that white coat hypertension. You could call it labile hypertension. Some people get nervous even checking their own blood pressure. So the bottom line is, do not get nervous checking your blood pressure once. When I ask people to check their blood pressure for me, I say, couple of days a week, check it in the morning, sometimes check it in the evening. And what we're going to do is average all of those blood pressures together. So they might be 160/90 when they're at work and they're under a lot of stress. Then they come home in the afternoon and they're 100/60.
It changes.
If you were to treat the high number, then the low number could go too low. So what you want to do is average these numbers together and get a realistic understanding. Now, you don't want to take a year to do that. I think the best thing that your viewers could do is start to get an understanding of what their blood pressure is, both at the doctor and at home.
And buy one of these monitors from any of these pharmacies. It's accurate, it's perfectly fine.
Absolutely. They may not be accurate to the exact digit, but remember, your blood pressure changes from 1 minute to the next. So you may get a number at home and think it's not right because when it's going to the doctor's office, it's different. But the reality is it's your blood pressure that's different. It's not a failure of the device. The devices are quite realistic in terms of giving you a general understanding.
Just for the record, I have tried over the years to turn his blood pressure really high because I'm probably the worst patient. Doctors are the worst patient. And the man is so calm and quiet, and I don't always follow up with my appointments. So I haven't been able to really raise his blood pressure over time. He's always so balanced and calm and
But David,
quiet.
it's very important to take care of you because a lot of people count on you.
Thank you very much.